My name is Keith Morrison. I'm an orthopedic hand surgeon here at Western Kentucky Orthopedics. Carpal tunnel syndrome is pretty simple. It's a compression of the median nerve at the carpal tunnel, and the carpal tunnel is basically right here at the base of your hand and wrist. It's a tunnel that all non-flexor tendons go through and the median nerve. And quite simply, carpal tunnel is where the median nerve gets compressed and then it causes symptoms into the hand and fingers. So a lot of people will have numbness and tingling mainly in the thumb, index, and middle finger. Sometimes some hand weakness, sometimes pain. A lot of times they'll have symptoms at night that wakes them up repeatedly at night. A lot of symptoms with driving, fixing your hair, talking on the telephone. Those kind of things are pretty consistent. Well, this model sort of shows the anatomy, and the carpal tunnel is basically right here between the thumb and the small finger right at the wrist. And this structure here is the transverse carpal ligament, and it shows the nerves coming out from under the transverse carpal ligament. And the nerve is underneath these tendons and it gets compressed. And that's what causes the numbness and tingling. So it's really a compression, a tightness in that tunnel. I mean, the most common thing is numbness, and again, mainly in the thumb, index, and middle finger, but some people will just have pain. Sometimes they'll have pain in their hand and wrist, even up to their elbow. A lot of people will begin to drop objects and lose a little bit of dexterity or strength, so that's pretty common sometimes too. Carpal tunnel is more common in women. It's more common in people with diabetes. It's more common once you hit middle age. So there's several factors involved in it. It's multifactorial, so there's really no one factor that causes carpal tunnel, but it's very, very common. A lot of times it's easy to make the diagnosis clinically, but I always get a nerve test to double check that, because sometimes you can have carpal tunnel, but you can also have contributing factors from your neck or your ulnar nerve at your elbow. So I think it's important to get a nerve test. And then the basic treatment options are bracing at night, and that really helps a lot of people. Sometimes that's the only treatment they need. Very few people you can do a steroid injection to the carpal tunnel, but usually that's sort of a temporary improvement. And then ultimately, if it's severe enough on the nerve test and they've failed conservative treatment, then sometimes surgery is the best option for that. You see it in all walks of life. It's not necessarily due to repetitive jobs, which is a misconception sometimes. People get it who never did a repetitive job. You see it in farmers, you see it in people work in factories, people who do clerical work. So it hits all age groups and all aspects, really. I think I would want people to realize that carpal tunnel surgery is really pretty easy and pretty straightforward. People who have surgery, it's an outpatient surgery. They're in and out the same day. And you can do most of your basic functions the next day. You can drive a car, you can cook, you can take out the trash, you can work on a computer, you can do most office and clerical work. So it's really a pretty benign surgery and a very quick recovery. So I would want people to realize that they're not going to be immobilized and not be able to perform or do normal things for several weeks. That's just not true. Well, I take a lot of pride in what I do, and I think you always want to be the best at what you do. So I want every case to be perfect, and I want everybody to do great. Again, because I want Bowling Green to have the care that you can get anywhere. So I want people to feel like they can get the best care here, and they don't have to go anywhere else to do that.